Adolescent idiopathic scoliosis is a condition which is commonly seen in children after the age of 10 years. It is usually seen in thin, slender girls. Usually before the onset of their puberty or the onset of the menstruation, or which we call it as the menarche, the child starts growing, and as the child's height increases, the growth of the spine also increases. It is at this phase that the spine begins to curve and to become a three-dimensional deformity known as the scoliosis. So we term it as adolescent idiopathic scoliosis because it is seen in children in the adolescent age group. We say it is idiopathic because we don't know the reason. So that's why we call it as adolescent idiopathic scoliosis. Usually the spine and the chest walls are connected. So the chest wall has the ribs which is in the front as well as the back. So as the spine gets rotated and twisted, the rib cage also gets distorted. So when the child bends forward or when the child sits, there will be a projection at the back, like a rounded bulge, which we call as the hunchback. This is the most disfiguring aspect of the scoliosis. As the child stands, the shoulders will be at different levels, the pelvis also will be different levels, and the child may be leaning towards one side as the central balance of the spine is displaced to one side. So this results in a cosmetically unacceptable position, and the patient or the child may try to wear loose garments to cover these deformities. However, the parents or the teachers may pick up these deformities and will be reporting to the doctors. Once the child has been found to have a scoliosis, he or she has to be under the care of an expert spine surgeon. The curve or the magnitude of the curve is assessed by making an whole spine X-ray in a standing position, and then it is calculated. Based on the angle of the degree of the curvature, we formulate a treatment plan. For some children with very small curves, the patient may have to wear a brace, which may be the whole day wearing brace up to 23 hours per day, or to some children who do not tolerate the bracing during the daytime may be asked to wear a nighttime bending brace. So this has to be individualized based on the patient profile, and patient has to be carefully assessed periodically, at least once in 6 months. Once the curve